Hello everyone, I'm Dr. PK from Dr. PK Life, and in this video we'll talk about beta-thalassemia, a genetic blood disorder that affects hemoglobin, the protein in red blood cells that carries oxygen. One of you asked me to do a video on beta-thalassemia, so here it is. Many people hear the term but do not really understand what it means and who is affected and how it is treated. Let's break it down step by step. What is beta-thalassemia? Beta-thalassemia is an inherited blood disorder where the body cannot make enough beta-globin chains, an important part of hemoglobin. And because of this, red blood cells are smaller, they break down faster, and oxygen delivery to tissue is reduced, and this leads to chronic anemia, meaning the blood cannot carry enough oxygen. There are three main types depending on severity. Number one, beta-thalassemia minor trait. One gene is affected, usually have no symptoms, mild anemia only, often found during routine blood test. Beta-thalassemia intermedia, so moderate degree of anemia, may need occasional blood transfusion, maybe few times in whole lifetime, and symptoms can worsen with age. Now, beta-thalassemia major is also called Cooley's anemia. Both genes are affected, and severe anemia presentation is starting in infancy, and it requires regular blood transfusion for survival. Of course, symptoms depend on severity, but it may include chronic fatigue, weakness, pale or yellowish skin, jaundiced, shortness of breath, delayed growth in children, enlarged spleen or liver, bone deformity in severe cases. Diagnosis is usually done with complete blood count that shows low hemoglobin and a small red blood cells. Hemoglobin electrophoresis confirms abnormal hemoglobin. Genetic testing is usually done for family planning. Iron studies is done to avoid misdiagnosing it as iron deficiency. So important thing to remember is that iron supplements do not treat thalassemia unless iron deficiency is proven. Treatment depends on severity. Mild cases, often no treatment is needed. Regular monitoring is needed. Moderate to severe cases, blood transfusion regular basis, maybe iron chelation therapy to remove excess iron from body, and folic acid supplementation. There's a curative option of bone marrow or a stem cell transplant, usually in children. And now there's a newer gene-based therapy also emerging, and that shows quite a bit of promise. So how it is to live with beta-thalassemia? With modern treatment, many patients live long and productive lives. Early diagnosis, proper monitoring, genetic counseling are key, especially before marriage or pregnancy. So if you or your family member has thalassemia, don't panic. Knowledge and regular care make a big difference. So if you find this video helpful, please share, subscribe, repost for more clear and doctor explained medical education. Thank you for watching.